In a groundbreaking revelation, a recent study led by researchers from Harvard T.H. School of Public Health, published in the American Journal of Clinical Nutrition, has unveiled a compelling link between red meat consumption and the heightened risk of developing type 2 diabetes. This comprehensive analysis, spanning years and involving 216,695 participants, has intensified the certainty of this association, shedding light on the potential health consequences of a diet high in red meat. The findings of this study have drawn a striking correlation. Individuals consuming as little as 2 servings of red meat per week may face an increased susceptibility to type 2 diabetes compared to those with a lower intake. Moreover, the risk appears to escalate with greater consumption of red meat, encompassing both processed and unprocessed varieties. Shockingly, participants who consumed the highest quantities of red meat exhibited a staggering 62% higher risk of developing type 2 diabetes in contrast to their counterparts who consumed less. The analysis further delineated the risks, revealing a 46% higher risk associated with each additional daily serving of processed red meat and a 24% higher risk with each additional daily serving of unprocessed red meat. The implications of these findings are profound. First, author Xiaogu, a postdoctoral research fellow in the Department of Nutrition, emphasized the significance of adhering to dietary guidelines that advocate for limiting red meat consumption. This recommendation pertains to both processed and unprocessed variants of red meat, as indicated by the research team. What exacerbates the concern surrounding this correlation is the pervasive nature of red meat consumption. Statistics from the United States Department of Agriculture underscore a staggering consumption rate of 30 billion pounds of beef in 2021 alone, translating to nearly 60 pounds per person annually. With such widespread consumption, a substantial segment of the population may find themselves within the heightened risk spectrum for type 2 diabetes. This revelation holds critical significance given the burgeoning rates of type 2 diabetes on a global scale. Beyond the immediate health risks, this dietary trend contributes significantly to broader health concerns, including cardiovascular diseases, kidney ailments, cancer, and dementia. The implications extend beyond individual health; they permeate into the environmental sphere. Agriculture, particularly livestock farming, shoulders a substantial environmental burden, accounting for a notable 11% of the world's carbon pollution. Notably, livestock is responsible for 14.5% of all planet heating pollution, as reported by PBS NewsHour. Hence, the escalated consumption of red meat not only jeopardizes human health but also amplifies environmental risks associated with climate change. Addressing these alarming findings calls for a re-evaluation of dietary habits. Researchers advocate for a significant reduction in red meat intake, suggesting that limiting consumption to approximately 1 serving per week could substantially optimize health and well-being. This dietary shift could pave the way for substituting red meat servings with alternatives like nuts, legumes, and plant-based options, thereby potentially reducing the risk of type 2 diabetes by 30%. Moreover, the environmental ramifications of such dietary alterations are equally profound. Studies project that replacing half of meat products with plant-based alternatives could curtail global agriculture-induced pollution by a third by 2050, as published in the Nature Communications journal. Notably, a study by an Oxford University professor highlighted that if the most avid meat consumers in the United Kingdom transition to low-meat diets, the environmental impact could be tantamount to removing 8 million cars from the roads. In essence, this research not only underscores the critical connection between red meat consumption and the risk of type 2 diabetes but also underscores the pivotal role dietary choices play in mitigating environmental concerns. It urges individuals to reconsider their dietary habits, advocating for a shift towards healthier, more sustainable eating practices for both personal well-being and global environmental health.